Thank you very much, Mr. Chairman. I'd also like to ask Ms. Fontenot a question, again, also about the Medicare rates and what the underlying bill would do to change Medicare compensation policy. I understand that the bill would have about $113 billion of reductions in Medicare Advantage payments, and that it has a one-year SGR adjustment, which then snaps back. But what other Medicare reimbursement policies are changed by the underlying bill?
Senator, I'm actually going to defer to my Medicare colleague on that and allow her to answer.
All right, thank you.
There are a variety of Medicare changes in the bill spanning from what we typically call the delivery system reforms, which are the policies that Senator Cantwell referred to that would move towards value-based purchasing for hospitals, home health, nursing homes, physicians, and so forth. There's provisions related to reducing hospital readmissions and reducing avoidable hospital-acquired conditions. So there's a whole host of, and then there's accountable care organizations, a whole host of delivery system reforms that try to move from a fee-for-service system to one that pays based on quality. There's also a set of provisions related to improving payment accuracy. So in areas where MedPAC in particular has recommended that the payment rates in Medicare are higher than the costs justify, we make changes to reform those payment systems, and you see a few of those changes in the package. And then thirdly, there is a host of provisions related to market basket adjustments, which over time would require increased productivity on the part of providers, and there's changes of that nature. So there's a whole host of Medicare-related provisions in the package.
And with regard to those provisions, what is the net budget impact of them? It's a reduction of some amount of money, but could you tell me what the net reduction of Medicaid spending is under those proposals?
Medicaid or Medicare?
Excuse me, Medicare.
Okay. I don't have the most recent number as some of the amendments have been accepted, but it's somewhere north of $400 billion.
In reductions?
Correct.
All right, that's adequate. Thank you very much. Mr. Chairman, I want to speak in opposition to the proposal for a government option for a number of reasons. Most of the debate today has focused on choice and competition, and I'm going to focus primarily on that as well. I strongly believe that if we were to adopt a government option, that the net result would be to reduce choice and to reduce competition. I personally see that a government-run plan is really the only way to surely reduce the kind of competition and choice that we need to be facilitating in the health insurance market. First, excessive regulation itself causes a reduction in competition. In fact, the Federal Trade Commission, in analyzing competition within the health care sector, stated, and I'm quoting the FTC at this point, not referencing this bill, but just referencing the issue of competition within the healthcare sector, stated that regulatory rules can also reduce the rewards from innovation and sometimes create perverse incentives, rewarding inefficient conduct and poor results. Restrictions on entry and extensive regulation of other aspects of provider behavior and organizational form can bar new entrants and hinder the development of new forms of competition. The point there is that as we move into more government controls over the provision of health care, we necessarily see the impact of excessive regulation on competition. Secondly, I personally think that the studies show that creating a government option will ultimately drive people out of the private sector and then again reduce competition. One independent estimate showed that a government-run plan with the ability to set prices at Medicare rates, and that's why I asked the question I had about Medicare, a government-run plan with the ability to set prices at Medicare rates will result in more than 118 million Americans losing their private insurance. Now, I know that there are people who say that these studies are not accurate, but the bottom line is that as we approach evaluating what establishing a government-run option would be, when that option, that government-run entity would have the ability to set prices and pay at Medicare rates, rates which we know today are not adequate, and which would result in an ability of that provider to be providing the mandated insurance at a much lower rate than the private sector is going to necessarily result in a reduction in competition. It's also going to result in a reduction in quality. You know, one of the arguments that has consistently been put out today is that Medicare, you know, the Republicans last week were concerned about the impacts of this legislation on Medicare, and why were they concerned about the impacts on Medicare if they truly oppose a government-run health care system, which Medicare is. The point of last week's debate was not to say that we should adopt a Medicare-type system. The point was to explain that Medicare is unsustainable, and that some of the things in this proposed legislation were going to make it even more unsustainable. In fact, last week, one of the amendments that I brought on Medicare was dealing with Medicare Advantage, as the chairman will recall, and the point that I made and many others made was that here in this one part of Medicare where we actually have succeeded in allowing the private sector to have some access to the provision of health care, we have phenomenally high levels of satisfaction and the opportunity to provide access in areas, rural areas of the country, which Medicare was not being successful in reaching. And yet what we are faced with a proposed government option is this. We today have two major health care government-provided systems, Medicare and Medicaid. Two major government-run health care entitlements in the United States, both of which are unsustainable, both of which are going to basically hit the wall and go off the cliff soon. And the proposal is that we should establish yet another major entitlement and have the government run it as well. Now, I understand that the proposal is not to have the government run all of it, though there are concerns by many of us that the net result will be a necessarily large transition of the health care provision in the United States beyond Medicare and beyond Medicaid into the new government-run proposal. And that can be nothing but harmful to competition. It's been said here today that 65% of the public supports a government option. I was reading today's latest polling numbers, which say that 56% of the public oppose the President's proposal, which has included in it a government option, and 41% support. So, and we can talk about how many in the public support this or how many in the public support that, but I think that anybody who paid attention during August when this Congress was home in their states knows that there is a significant amount of unhappiness about the notion that we should move toward a government-run option in our proposed health care systems. Lastly, back to the question of competition. What can we do to really deal with competition? We've had a lot of discussion about how many effective insurance companies there are and what kind of competition there really is in the marketplace. And I and my colleagues on this side have acknowledged that we need to do things to increase competition and to strengthen the private sector and the ability of people to compete. Well, for one, we can expand those insurance pools by allowing for AHA insurance pools like we've talked about before. Let small businesses group together and expand business pools or insurance pools, which will in and of itself create tremendous ability to bring downward pressure on price and upward pressure on quality and product as we have a more robust competitive environment. We can allow competition across state lines, which also will help to expand pools and increase competitive opportunities. And frankly, we can look at the causes of why we see some market entrants leaving market participants leaving markets these days, which much of which has been identified as very, very restrictive state laws that have made it very difficult for companies to effectively compete by adding continuing mandates onto the product requirements of the companies as they provide insurance. It's some of these things to help make the market more robust and more capable, to expand insurance pools, and to approach the question of providing greater competition by looking at what it is that is stopping competition in the markets today that we should be focused on, rather than saying, you know, since we would like to see greater competition and greater choice, we want to turn to the government. Experience in the past has shown that turning to the government as an alternative is not going to provide that choice and is not going to provide that competition.